My name is James Warnes, and with pharmacist with Pharmacy Solutions, and I have the unique opportunity to be able to speak today about Synapsin. And I just want to welcome you, Dr. Bibi Sattar. Thank you so much for coming and being able to share some more insight that you have with your practice and with some of the patients that you're having. Dr. Sattar has been practicing for 15 years as an osteopathic physician, with focusing on treating the patient as a whole rather than just individual symptoms. So practicing family medicine, all-encompassing care and compassion for her patients from beginning to end. So thank you very much for being here.
Definitely.
I really appreciate
Glad
it.
to be here.
So thank you. So let's just dive into Synapsin. We've done a couple of different podcasts and informationals about this product, and I would love to be able to speak with you about it further. How did you first hear about Synapsin?
Well, back in October, I went to a conference put on by George Washington University, and one of the speakers there, we were talking about mitochondrial health overall, and just how chronic inflammation really leads patients to these chronic illnesses down the road, and how getting back to the root of the issue can see real turnaround for these patients. So just reading more on mitochondrial health and inflammation, chronic inflammation, led me to the Sears diagnosis, the chronic inflammatory response syndrome. And part of the treatment of that is whatever we can use to decrease inflammation. And Synapsin was a big part of that for the neuroinflammation component. And I've just expanded from there since I started using it on patients, had remarkable results, and we've just expanded the use from there.
Great. Well, how did you hear about us specifically, about Pharmacy Solutions?
Well, since I've started my practice, I've been using Pharmacy Solutions. You guys are awesome, very trustworthy. I know when I prescribe something, I get exactly what I prescribed. And I also know if I prescribe something and you say, I'll get a call from you guys to say, what about this? What about that? So, and you're looking, and that is really what keeps me here, is that I trust you guys 100% to do right by the patient.
Yes, that's very important for all of us, and that means the world to hear that back from you.
Absolutely.
So thank you for sharing that. Talking about Synapsin, as far as the disease states and disorders that we're using, obviously we kind of started with CIRS, chronic inflammatory response syndrome, but what other disease states or disorders have you noticed, or have you used it in your practice for Synapsin?
We have a patient who has chronic seizures. I have two patients now with seizures that I've tried it on. One of them, remarkable results. The other one, we had some improvement. We're still waiting on results from that. ADD, ADHD, just getting patients supporting meds, but also getting patients off of medications. So I have one particular patient has 20-year history of vertigo, has been on anti-seizure medications for the vertigo, and is now off of everything.
Wow.
It's been pretty amazing. Fatigue, the brain fog, that chronic fatigue from the inflammation part has been really life-changing for a lot of my patients. I had a patient come in and say, hey, remember that fatigue I've been telling you about that I've had for 20 years? It's gone.
Wow.
Yeah.
So my next question was going to be, tell me your impression, but I think we've kind of gotten a lot of the high points on that. So obviously it's somewhat positive.
Just a little.
No, that's
it's
great.
been quite amazing.
Do you mind sharing a more particular story or a testimony as far as a unique case that you've had with this particular product and its implementation?
The ADHD patient that was diagnosed at 4 years old, she's 15 now, has been on medication since she was 4 years old, went through a recent traumatic event, and basically we she went from being a straight A student to not so great in school. Mom brought her in a couple of months ago, I think, and we put her on Synapsin. She's back to her normal self. She's got the ADHD is under control. She's doing well in school again. That's one particular one that I feel like we've made just such a huge impact on her entire life. Is that at 15 years old we can say, look, there's a way for you to get back to who you are, rather than me throwing every medication at her. And the vertigo patient. So he's been to everybody. I mean, he's been to UT Southwestern, he's been to multiple ENTs, neurologists, everything. And he's been on so many medications. When he was on the anti-seizure medications, we had all the metabolic effects of that. And for him to have, he's 50, for him to have the rest of his life not having to deal with a seizure medication and to not have those symptoms anymore is a game changer.
I realize this particular product is not going to be for everyone, but in your specific cases of the patients that you've utilized this for, do you have a way to quantify that as far as how effective or some sort of effect that you've gotten with Synapsin with the implementation of these patients for their disease states?
So I have about 35 patients going through my SEERS protocols right now, and 2 of them have not responded to the Synapsin. One, I suspect there's a lot more going on there that I just have to keep looking to find out what exactly is there. But of the 35, 2 have not responded. Of the non-SEERS patients that I've written a prescription for, I'm pretty sure they've all responded.
Wow.
Yeah, it may not be as dramatic as some of the other patients, but they've all felt some improvement.
Well, but to that effect, we normally don't recommend this in itself. Obviously, this is not going to treat. This is not going to treat underlying these disease states such as, whether it's Parkinson's or Alzheimer's or all of these other different disorders, Lyme disease, ADHD. They have found some as far as ADHD, but usually this is intended, and so I want to reiterate the part of it's as adjunct therapy. So we're helping with symptoms, the underlying issue, or dealing with the underlying portion of the actual inflammation itself. We need to make sure we're addressing that rather than just trying to temper and or lower the inflammation. So that's
absolutely
very
yes.
helpful to hear.
Mm-hmm.
So we kind of talked about as far as the SEERS patients, but do you have any idea of an estimation on the amount of patients you think that this is impacted in your practice comprehensively?
So I think I've written probably like close to 100 prescriptions, I feel like. So it's I'm not going out seeking patients, but as they come in to say, okay, my depression has gotten worse, and I say, let's try this, or hey, the med isn't quite working as well as used to, then those are the things. So in those types of patients probably are going to be about 40-50% of my patient population. For me, I feel like it's definitely worth a try when we're working up other disease states and we're trying to find root causes. And I feel like it just gives such a good benefit to the patient that to me, I've been willing to try it and just try on new disease states to see what benefit we get. So I'm excited to see what we can get out of the Synapsin and what use these patients can get out of it.
I really thank you for your time,
Absolutely.
Dr. Sattar. This has been really, really neat to hear, and it's great to hear the feedback as far as how it's positively impacted your patients, and I don't foresee why anything would change as far as that. Hopefully we'll just continue to see more growth, being able to impact patients. So that's ultimately why we are here as medical professionals. So it's really neat to see. So thank you very much.
Glad to be here. Thank you for having me.